related injuries and electrocution, electric shock injuries, and death injury due to starvation. At the end of the session, the participants will be able to describe features, causes, and forensic aspects of following injuries: cold-related injuries, heat-related injuries, electrical current injuries, electrocution, lightning injuries, and starvation. Cold injuries include hypothermia, frosting, chilblains, immersion foot, and frostbite. Thermoregulation of the human body, skin and subcutaneous tissues are maintained at a constant temperature about 98.6 Fahrenheit by the circulating blood. Blood gets its heat mainly from the energy given by the cellular metabolism. The optimum temperature for most enzymatic reactions is 98.464 Fahrenheit. In hypothermia, most organs, especially the heart and brain, become sunless and eventually stop working. This is human body has some radiation, evaporation of heat and cold system. When body temperature falls on exposure to cold, several protective mechanisms are recruited to generate additional heat. For example, the muscles produce additional heat through shivering. Peripheral vasoconstriction diverts blood flow to organs. If body temperature falls much below about 88 degrees Fahrenheit, these protective mechanisms stop working and the body cannot rewarm itself. If body temperature falls below 83 degrees Fahrenheit, death is likely to occur. What is the chilblains? Chilblains are small itchy red patches that can appear after prolonged or intermittent exposure to temperatures above freezing and highly humidated with high wind environment. Initial paler characterizations chilblains followed by erythema and pruritus of the skin of the affected area. The cold exposure causes damage to peripheral capillary beds. The condition is uncomfortable but not serious. Preventing exposure to cold is the best treatment in this case. What is frostbite? A thermal injury to the skin resulting from prolonged exposure to moderate cold or brief exposure to external cold. Ice crystals form in and around skin cells due to decreased blood supply. Typically, hands, feet, nose, ears, and cheeks are involved. Side symptoms of frostbite include pain, itching, numbness, swelling of the area, prickly sensations, mottled blotchy skin. Firm white skin areas occur, hard, the peeling or blistering of the skin, grayish yellow skin appearance. Frostbite can be divided into 4 categories. First degree frost nip. It shows partial skin freezing, stinging and burning features followed by throbbing, numbness of the area, erythema, swelling, dysesthesia, desquamation days later. Prognosis is very excellent. The picture shows first degree frostbite. The second degree of frostbite shows full thickness skin environment, which shows freezing, numbness followed by the itching and throbbing pain. Skin blisters from within 6 to 24 hours occur. These commit and form hard blade over several days. Prognosis is very good. Third-degree frostbite shows clinical features which include damage extends into the subdermal plexus, extremely feels like a block of wood, followed burning, throbbing, shooting pains, hemorrhagic blisters form and are uh, skin necrosis after skin necrosis and blue-gray discolorations occur. Prognosis very often is very often. Tissue loss involved entire thickness of the skin. Fourth degree, the last degree or the final degree, extension into the subcutaneous tissues, muscle, bone, and tendon, little edema, deep itching, uh, joint pain. Skin is mottled with non-blotching cyanosis and formation of deep, dry lake texture. Prognosis is extremely poor. These are the photo images of the different stages of the frostbite. Frostbite, bluish discoloration shows exposure to temperature below freezing leads to severe soft tissue damages. Fingers with the frostbite, blackish in the color. And left side, you see the normal fingerprints fingers that first stage frostbite, then operatively second stage, you see the third stage, and also you see the fourth stage of the frostbite. Now we discuss about the trench foot, which is also called immersion foot. It develops slowly over hours and days, and foot exposed to cold and wet conditions. Reversible injury may progress irreversible injury. Foot or immersion foot is a type of tissue damage caused by prolonged exposure to cold and wet conditions. It leads to swelling, pain, and sensory disturbances in the foot. It can lead to damage to the blood vessels, nerves, skins, and muscles. You can see the picture of the French foot immersion. Treatment is gentle rewarming. Do not park on the foot. Usually it occurs on those people with travel and, uh, and high altitude with the snow and ice, like glaciers and in our country, northern areas uh, of the country near the Himalayan mountains, where the ice is frequent. Long exposure of the trench foot to wet conditions, 50 degree Fahrenheit or 32 degree Fahrenheit, it occurs. Stage 1 cold and painless areas, pulses weak and numbness. Stage 2 hot and burning, shooting pain. Later stages, pulses, skin is pale with a bluish cast, decrease, pulse, blister, swelling, redness occurs. Treatment, what is the treatment of the patient? Do not expose injured part to an open fire. Rewarm the injured part gradually by exposing to warm air, not fire. Protect the part from trauma and secondary infections. You use dry, loose clothing or several layers of warm coverings. Elevate the foot. Do not massage, moisten, apply heat or ice. Uh, Next is the hypothermia. Hypothermia means people suffering from low temperature Uh, People with disabilities, people at risk of hernia include sick people, old people, very old people, and people with some disabilities or previous injuries or disease. Hypothermia, as in early uh, stages, shivering occurs, pulse is infant, drowsiness, mental slowness, stiffness, lack of coordination, sullen speed. Moderate stage of the hypothermia include glassy eyes, slow and shallow breathing, weak, very weak or absent pulse, increasing stiffness, lack of coordination, and also you see unconsciousness of the patient. In severe hypothermia, frozen extremities uh, will occur, irregular heart actions, and that leads to sudden death. Treatment of the patient: remove person from the cold, remove wet clothing and put on dry clothing, warm front first, not hands and feet, do not immerse in warm water, do not apply heat directly to the skin, CPR if needed, warm fluid, avoid caffeine or alcohol. Hypothermia, first aid for the life-saving measures. Remove wet clothing, use dry blankets or sleeping bags. Initiate external rewarming with the heat packs, hot water bottles, chemical packs placed in the axilla, groin, and abdomen. In dire circumstances, when heat packs are unavailable, rescue can provide skin-to-skin contact with patients. Electrocution. Electricity affects human body. Electrocution is the death caused by the electroshock, either accidental or deliberate, is called electrocution. Electric shock of a human body with any source of electricity that causes a sufficient current the skin through the skin, muscle, or air. Typically, the expression is used to denote the unwanted exposure to electricity, hence the effects are considered undesirable. Uh, Water conducts electricity, so using wet hands or standing on a wet floor while handling an electrical appliances may increase the risk of an electrical injury. And if person is neglected, then will get an electrical current injury. These are the pictures which shows the pathway of the electricity, the entrance wound and the exit wound on the fellow. The amount and type of the damage caused to the body by electricity depends on the type of the current, which may be AC current or DC current. AC current means alternate current, and DC means direct current. Amount of current in ampere form, voltage, resistance, duration of the event, and root of the current. Electrical injuries entry mark shows imprint of the conductor. Pattern of electrical burns may indicate torture or homicide. No mark seen if the contact point was broad. Water considerably reduces resistance. These are the pictures that show the electrical burn injuries, entry wound, classical lesions. The contact wound shows in black and white pictures. Postmortem appearance. The picture shows the dead. Postmortem appearance in points are the clothes are usually burnt or torn at the point of entrance and exit. In some cases, the clothes may be stripped off the body and thrown to some distance. In exceptional cases, clothing is not damaged even if the person is killed by the lightning. Conversely, clothing may burn without any injury to the person. Clothing examination in medical legal purpose is very important. Doctor must, doctor who work medical legal examination, they must conduct examination of the clothes. The expanded displaced air causes disruptive or blast-like lesions or rupture of the organs. Rigor mortis may appear soon and pass off quickly. This is an important appearance. Rigor mortis may appear soon and pass off quickly in electrocution cases. Electrical current through the body can cause breathing or heart. These are the sign signals. Breathing or heart to stop and can lead to the collapse of the burns. Current which causes electrocution usually comes from the low or high voltage electricity and lightning. Low voltage 1000 volt up to 1000 volts and high voltage more than the 1000 volts and lightning up to the more than sources of large high voltage electricity which may cause injuries can be found in appliances, the home appliances and the cables found in the home, office, workplace and shops and electrical poles. Lightning. Lightning is a form of high voltage current. Electrical bolt of the light is produced when the electric charged surface of a storm cloud discharges electrical canal to the earth. Lightning conductor is a metallic object mounted on of an elevated structure such as a building bound using wire or electrical conductor while interferes with the ground through an electrode engineered to protect the structure from lightning strike. ये आपने अक्सर लाइटनिंग कंडक्टर जो है बिल्डिंग्स पे जो इम्पोर्टेंट बिल्डिंग्स हैं उन पर लगे हुए देखे होंगे. ये प्रिवेंशन के लिए इस्तेमाल होते हैं लाइटनिंग. Mechanism of lightning injury. Lightning current inflicted on a person in one of the several ways. Direct strike, exposure हो जमीन पे बना खड़ा हो और उसके ऊपर जो है आसमानी बिजली जिसको हम लाइटनिंग कहते हैं उसको आसमानी बिजली भी कहते हैं कि डायरेक्ट जो है उसके के साथ एक्सपोजर हो जाए या फिर ये है कि कॉन्टैक्ट इंजरी हो या कोई बलंट इंजरी हो किसी दूसरी चीज से रिफ्लेक्ट होकर इंजरी आए और करंट आ जाए. These are pictures which are very typical with the lightning injuries. You see the prominence of the wound on the back of the chest and legs of the person. Now come to the heat-related injuries. Minor heat injuries, heat edema, it occurs, heat rashes occurs that are known as the prickly heat swellings, heat cramps due to direct deficiency in the electrolytes and fluids, and heat fainting, and it should be treated with fluid and rest and removal from the hot environment. Minor injuries, hypothermia, elevated body temperature due to failed thermoregulation that occurs when a body produces or absorbs more heat than it dissipates. Hypothermia defined as the temperature greater than 37.5 to 38.3, 99.5 to 100.9 Fahrenheit. That this is the range that occurs without a change in the body's temperature set point. The spectrum of the heat illness, heat edema and rash occurs, then heat cramps, heat syncope, heat exhaustion, and heat stroke. Heat edema rash, they appear pitting like pitting edema, mostly commonly in head and feet. You can they can last it can last from days to weeks. Bedridden elderly people are very prone high temperature vasodilation fatigue edema. Treatment self-limited reassurance limb elevation bandage avoid high temperatures and adequate uh, rehydration. Heat cramps, localized painful involuntary spasm of the muscle, skeletal muscle occurs. The causes of heat cramps are sodium and chloride depletion, dehydration, impaired circulation, working muscles. Most commonly affected muscles are calf, quadriceps, hamstrings, and abdominal muscles. These are the symptoms which occur in heat cramps. Treatment slow passive stretching of the involved muscle massage of the area and eyes. Uh, Fluid replacement may return to activity when symptoms subside. Heat syncope occurs as a result of insufficient blood supply to the brain due to vasodilation of the skin vessels, which leads to decreased venous returns and less carbon dioxide gets low fusion of the brain, and finally it leads to the fainting of the person. Due to drop in the blood pressure as a result of vasodilation of the circulatory system. Heat exhaustion, most common form of the heat illness caused by the uh, increased activity, sports, decreased fluid intake. Symptoms are headache, weakness, fatigue, skin is moist, hyperventilation, low blood pressure, and fast, weak pulse, anxiety, and confusion, mental states. Heat exhaustion management moves to a cooler, move the patient to a cooler location, lie down, and loosen the clothes, apply wet cold towels, ice, use fans, adequate oral IV fluid replacement. Heat stroke. A life-threatening clinical syndrome characterized by loss of the temperature regulation capabilities. Uh, the third most common cause of death in the athletes in the United States is the heat stroke. Diagnosis an individual who collapses after exposure to hot environment. Rectal temperature will be 41.1 degrees Celsius. Uh, that is equivalent to the 106 Fahrenheit. Neurological dysfunction occurs. Now we discuss starvation. Starvation it may occur from the actual withholding of the food or from the administration of unsuitable. Types are acute results from the sudden stoppage of the blood, and chronic results from the gradual deficient supply of the food. Causes famine, uh, trapped in the pits and mines, people, neglect on part of the parents, a willful withholding of the food, willful refusal to take food, which कुछ सोशल ग्रुप्स में जो है कस्टमरी फीमेल को जो है खाना पीना या जो है फूड कम दिया जाता है, ये अक्सर हमारा राइटिंग में भी आता है। एंड खासतौर पे ये कहा जाता है कि जो लो सोशियो पुअर लोग है वो फीमेल को खाना कम देते हैं या जो है अच्छा खाना नहीं देते। कुछ वो लोग हैं जो माइंस वगैरह में काम करते हैं और रेप हो जाते हैं, खाना पीना से महरूम रह जाते हैं। इस तरह के लोगों को लगते हैं। नेग्लेक्ट एंड पार्ट ऑफ द पेरेंट्स, लोग जो बहुत ही पुअर होते हैं जो अपने बच्चों को जो है खाना पीना नहीं दे सकते। और विलफुल हो विद होल्डिंग ऑफ द फूड, कुछ लोगों को जो है उनका खाना पीना बंद कर दिया जाता है ताकि उनको सजा आए पनिशमेंट के लिए। विलफुल रिफ्यूजल टू टेक फूड भी होता है। कुछ बच्चे नाराजगी में, कुछ लोग बड़े नाराजगी में रिजेक्ट करते हैं, खाना नहीं खाऊंगा, मेरा ये मुतालबा है या ये चीजें डिमांड पूरी नहीं करोगे। और कुछ जो है वो सियासी पॉलिटिकल लोग होते हैं جو اپنے ڈیمانڈ وغیرہ رکھتے ہیں. جیلر قیدی سم ٹائم جو ہے وہ بھی کھانے پینے سے ہاتھ اٹھا لیتے ہیں اور بھوک ہڑتال شروع کر دیتے ہیں. Symptoms are acute starving میں first 30 to 48 hours and gastric chronic starvation میں جو ہے loss of well-being ہوگا, hunger and pains, hypothermia بھی ہوگی, edema بھی ہوگا, بلڈ شوگر لیول کم ہو جائیں گے. واٹر پیریڈ جو ہے 10 دن جو ہے بھوک ہڑتال کھانا نہیں ملے, فوڈ ڈپریویشن ہو تو 10 سے 12 دن میں جو ہے ڈیتھ ہو سکتی. اگر صرف جو ہے کھانا پانی ملتا رہے اور پانی اور فوڈ دونوں بند ہو تو 10 سے 12 دن میں ڈیتھ ہو سکتی ہے. صرف فوڈ بند ہو اور پانی چلتا رہے تو 6 سے 8 ویک تک جو ہے وہ ڈیتھ ہو سکتی ہے. فیکٹرز دیٹ انفلوئنس دی فائٹل پیریڈ, ایج, very young and old suffer the worst. Sex, female withstand starvation for longer period. اللہ تعالیٰ کا بڑا کرم ہے, فیمیل جو ہے وہ زیادہ ریزسٹیبل ہے بھوک کے خلاف. ان کو کھانا کم ملے تب بھی جو ہے وہ برداشت کر لیتے ہیں. یہ قدرت کی طرف سے آتی ہے. Temperature exposure to cold or excessive heat as in the death, physical exertion, active physical exertion as a death, cause of death, exhaustion, circulatory failure, to bone atrophy of the heart. یہ جو ہے bone atrophy of the heart is a postmortem sign seen in the started death. انٹرکرنٹ انفیکشن ان لوگوں میں زیادہ ہوتا ہے کیونکہ وہ امیونٹی کم ہو جاتی ہے, کھانا پینا کم. ڈیہائیڈریشن ہائپوتھرمیا بھی دیکھی جا سکتی ہے. جو باقی میں پوسٹ مارٹم میں جو ہے گال بلیڈر از ڈسٹینیٹڈ ود بائل, یہ ایک خاص جو ہے پوسٹ مارٹم میں آٹوپسی میں جو ہے دیکھا جاتا ہے کہ گال بلیڈر جو ہے وہ ڈسٹینیٹڈ ہوتا ہے, فل ہوتا ہے بائل کے ساتھ, کیونکہ وہ کھانا پینا ان کا نہیں بن رہا تو اسٹامک میں جو ہے وہ بائل جا نہیں رہی, اور بائل جو ہے وہ مکس ہوتا ہے گیسٹرک ایکٹیویٹی میں فوڈ کو ہضم کرنے میں. اس لیے جو ہے کیونکہ فوڈ ہی نہیں ہے اسٹامک میں جا رہی تو جو ہے گال بلیڈر ڈسٹرب کر دیتا ہے. یہ خاص جو ہے آٹوپسی فائنڈنگز ہے. Kidney shows atrophy of the nephrons and lungs are pain collapse. The heart is small from the ground atrophy. There are some evidence of some intercurrent disease اور بھی کچھ باڈی میں جو ہے وہ ویکنیسز illnesses دیکھی جا سکتی. میڈیکو لیگل میں یہ ہے کہ اگر آٹوپسی میں ایسے کیسز کو لایا جائے تو 2-4 چیزوں کا جو ہے وہ مینر آف ڈیتھ دینا بڑا پہلے کنفرم کرنا کہ ڈیتھ از ڈیو ٹو اسٹارویشن ہے. جب وہ کنفرم ہو جاتی ہے تو پھر یہ ہے کہ مینر آف ڈیتھ دینا پڑتا ہے ڈاکٹر کو. تو یہ سوئسائڈل اسٹارویشن ہے, ہومیسائڈل اسٹارویشن ہے, یا نیگلیکٹ ہے, یا اس کی جو ہے کوئی ایسی اس میں جو دیکھنے والی چیز ہے, کوئی بیماری کی وجہ سے تو نہیں ہے, کوئی میلیگننسی تو نہیں تھی, کوئی ایسے ڈائبٹیز کا پیشنٹ یا ٹیوبرکلوسس تو نہیں تھا. یہ ایکسکلوڈ کرنا, ڈیزیز ایکسکلوڈ کرنا پڑتا ہے. سرکمسٹنس دیکھے جاتے ہیں. جیل میں ہے تو اکثر جو ہے جیل میں لوگ جو ہے وہ ہنگر اسٹرائک وغیرہ اپنے ڈیمانڈ کے لیے کرتے ہیں, یا ان کو فوڈ ڈپرائیویشن بھی ہوتی ہے, اچھی نہیں ملتی. اور کچھ جو ہے وہ پولیٹیکل لوگ ہوتے ہیں جو بھوک ہڑتال پہ بیٹھے ہوتے ہیں تو وہ بھی جو ہے کھانا پینے سے ہاتھ اٹھا لیتے ہیں اور اپنے ڈیمانڈ کے لیے. تو یہ سرکمسٹنسز بھی جو ہے دیکھنے اور کاز آف ڈیتھ کو اور جو ہے سرٹیفائی کرنے کے لیے جو ہے ان چیزوں کا معلوم کرنا, انفارمیشن لینا بڑا ضروری ہوتا ہے.